Serving Northeast Ohio, University Hospitals performs thousands of MR scans a year. Most are done with conventional cylindrical scanners. Patients who cannot be scanned inside the cylinders of these machines can choose high-field open MRI.
I was at the hospital. I didn't fit in the tube. My arms barely fit physically into the tube, but my nose was almost on it and I couldn't move at all. So it was really uncomfortable. It wasn't going to work. So they pulled me back out and said, let's go to a bigger tube. And then I looked around and I found this one, the open one. So it fits for me.
The scanner is called Oasis. Its openness does not compromise image quality, says Dr. Pablo Ross.
And we can do what we need in general patients that, yes, could go inside a close magnet, but the quality of the images for the routine scans is extraordinarily good and accepted.
Before University Hospitals acquired Oasis, the quality of images produced by this machine was assessed by radiologists specializing in brain, abdominal, and musculoskeletal MRI. Dr. Christos Cosmos was among the early evaluators. Today, he routinely reads images from Oasis.
For MRI of the shoulder, there's actually a benefit in the open system because you can position the patient in the isocenter, the shoulder in the isocenter, while in a closed cylindrical magnet, the shoulder will always be off the isocenter and might affect the quality of the images. So we have very good results from our MR shoulders. Certain patients, let's say in obese patients, by placing the shoulder in the isocenter, we might get better images, and we have cases where I believe the images are better than a 1.5 closed system.
Just as Oasis serves large patients and those who have trouble with tight spaces, it scans everyday patients. Some require advanced techniques. Having flexibility and range without compromising image quality is a must. Like the 30 high-field scanners that the UH operates, the Oasis is there, says Dr. Ross, for the convenience of patients.
We feed it with patients that are routine scans, majority joints and brains, that are in the vicinity. And therefore, just geographically, it's more convenient to go to an outpatient facility with immediate parking and without emergencies.
High-field open MRI for patients who cannot be examined with conventional scanners, as well as for those who can.